Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California.
On this episode, we're going to talk about lead exposure and its impact on child development, as well as strategies for preventing it.
Right. So lead exposure is one of those things that's definitely talked about less now, but it's still a really real risk, especially for kids. So 3% of children in the United States have an elevated blood level, which we define as greater than or equal to 5 micrograms per deciliter.
Yeah, so that's true. Lead poisoning has decreased significantly in the U.S. over the past few decades, and that's thanks to regulations that started coming into play in the 60s and 70s. So that included elimination of lead from gasoline, from paints, and other consumer products such as canned food liners.
And you were very much alive and involved in that time.
Oh, yeah. Yeah. I mean, there used to be leaded gasoline, and then people would say, don't be careful with that stuff. And there'd be like lead deposits on the side of the road and all. Yeah.
Oy, yikes. Mm-hmm. So although we've made huge strides when it comes to reducing the risks of lead exposure with some of those things that happened in the 60s and 70s, we're definitely not living in a lead-free country. So I think most of us from my generation think of Flint, Michigan, and the water crisis there when we start talking about lead in kids.
Yeah, that's right. And as a reminder, in 2014, there was a pediatrician in the city of Flint, Dr. Mona Hanna Atisha, and she noticed that her pediatric patients were showing elevated levels of lead since the city changed its drinking water pipeline. So she sounded the alarm about unsafe levels of lead in the drinking water in the city.
And she actually wrote a book about her experience, What the Eyes Don't See. It's a great example, really, about how one person in partnership with local community members and advocates and legislators can identify and address public health issues when they're present.
So let's talk about why lead is so bad for kids.
Yeah, so lead exposure, especially at high levels, has been identified as a causal risk factor for diminished intelligence and academic abilities, higher rates of neurobehavioral disorders such as ADHD or attention deficit, and lower birth weight in children.
So the American Academy of Pediatrics, our parent organization, recommends targeted screening of children ages 12 to 24 months of age living in communities that have more than a quarter of housing built before 1960, or a prevalence of lead levels greater than or equal to 5 micrograms per deciliter of greater than or equal to 5%, or children who live in or visit a home or child care facility with an identified lead hazard, or children living in a home built before 1960 in poor repair or renovated in the past 6 months.
So those are the types of questions that your pediatrician may ask you to look for the possibility of lead exposure at your child's 1-year checkup. The AAP also recommends screening immigrant, refugee, or internationally adopted children when they arrive to the United States because of higher risks of contamination abroad. I have mentioned that I work in a federally qualified health center, and we take care of a lot of Afghan patients who have come here on special immigrant visas after they helped the U.S. in the U.S.-Afghanistan war. And I would say I rarely see a normal lead level in that patient population because of the risk factors in the soil and other things in the community. And sure enough, once they arrive and we continue to check it, the level goes down.
So let's talk about sources of possible lead exposure. I think the most common source people think of is old paint, because old paint used to contain lead.
Yeah, that's right. So lead-based paints, that's kind of it's a tongue twister. Yeah. They were banned for residential use in 1978, but homes built before may still have lead paint on the walls, particularly under new layers. My house was built in 1912. So I'm sure we've got some lead around here. So as the paint ages and deteriorates, it can chip and turn into dust, which then can accumulate on the floors, and kids can easily ingest or inhale.
So the kid doesn't actually have to eat a paint chip to get exposed in this situation.
Correct.
Yeah, and toddlers, we know toddlers, as part of their normal development, they're crawling all over the place. And so they're crawling on their hands, and due to the normal development, they're prone to picking stuff up and putting it into their mouth. It could be toys in the environment. It could just be their hands and they're sucking on their fingers or something. So they could be touching all these contaminated surfaces and then getting exposed that way. And that makes them the most likely to be exposed.
Yep. And it's not just paint. Lead can also be found in drinking water if you've had lead pipes, in soil contaminated by some old gasoline, or even imported toys or products with lead-based components like bullets, fishing, sinkers, soldering, stained glass, pottery glazing. I remember when growing up in San Diego, we would get a lot of like Mexican candy across, and there was always like, my parents were like, there's lead in that. Don't eat it. Again, like speaking to some of my cultural experiences with Afghan patients, they use a eyeliner called surma on themselves and babies even. So traditional cosmetics can sometimes have higher lead concentrations. So these are all types of things that we need to be thinking about and educating people about.
I still recall recently getting like pottery as a gift, and then it like might have a sticker on it saying not for use with food, right? And you're thinking, oh, I'll use this as like a fruit dish or something. And then you're thinking, no, I think not, because it might have lead in the glaze or something.
Yeah, exactly.
Yeah. And so there's also lead exposure in certain occupations like construction or auto repair. And then lead-containing materials are used in these occupations. So workers can bring home lead dust on their clothing and shoes, and this may expose their families unknowingly.
Right. So let's talk about some of the effects that lead has on development. So we know lead is a neurotoxin, which means it directly harms the nervous system. The younger the child, the more vulnerable their developing brains are to its effects.
So blood lead concentrations of children who live in lead-contaminated environments typically increase rapidly between 6 and 12 months of age due to their exposure. They peak between 18 and 36 months of age, and then they gradually decrease. The peak in children's blood lead concentration stems from the developmentally appropriate mouthing behaviors that we mentioned, and then their increased mobility so that they can be exposed to other areas. Younger children also absorb lead more efficiently than older children and adults. And also, iron deficiency is common in this age, and this can also increase the absorption of lead.
Yeah, so having enough iron is protective against absorption of lead, but having iron deficiency can increase your risk for it. And the damage from lead really is irreversible. So it can lower a child's IQ, slow their growth, cause learning difficulties, attention problems, and behavioral disorders like hyperactivity and aggression. In very severe cases, lead poisoning can lead to vomiting, abdominal pain, fatigue, headache, seizures, or even coma. And thankfully, symptomatic lead intoxication is rare, but it is considered a medical emergency.
But even at low levels, chronic exposure can cause developmental delays. Kids may struggle in school, have trouble focusing, and they can fall behind their peers academically. In women who are exposed while pregnant, the newborn can also have low birth weight.
Studies that have looked at lead levels and IQ have shown that children who have a blood lead level concentration greater than or equal to 5 will, on average, have a lead-associated IQ deficit of 6.1 points, which is not insignificant.
No, it's, every IQ point counts, right? So we've talked about where lead comes from and its effects, but let's move on to what parents can do to prevent exposure. The key to preventing lead toxicity in children is identification and elimination of the major sources of lead exposure in the environment, because once exposed, there's less that we can do to treat it.
Yeah, absolutely. So if you live in a house that was built before 1978, it is worth having the paint and soil tested for lead. Many times this will be done like during the home inspection process. For us, like we recently renovated a bathroom. And so that was like part of what we did before starting the renovation to make sure we weren't going to like kick up all of this lead-based paint into our home. If lead is found, it's important to have it professionally removed or contained. Don't try to do this yourself. You could stir up even more dust. And if you're living in a rental, really, it is the landlord's responsibility to remediate this.
And for families living in older homes, routine cleaning is key because you want to get rid of any possible lead paint dust. So wet mopping floors, wiping down windowsills, and washing your child's hands and toys regularly can reduce the risk of ingesting lead dust.
Yeah, water as a source of lead exposure, especially in older cities where lead pipes or fixtures are still in use. You can test your home's drinking water, especially also if you're using well water. That's a great precaution. And if you're concerned, there are water filters that are certified to remove lead.
One thing I'd add is that a nutritious diet, particularly one rich in calcium, iron, and vitamin C, can help reduce the body's absorption of lead. Kids who are malnourished may absorb more lead, so good nutrition can be a protective factor.
So parents are thinking, okay, great, we'll prevent it, but what happens if we're exposed? What steps should we take then?
So if a child has an elevated blood lead level, the first step is to remove the source of lead exposure immediately so that it doesn't continue to rise. So that might mean moving out temporarily during lead abatement or switching to bottled water if the water's the problem.
In the doctor's office, you might first get something called a capillary blood sample. So that's when you get a little finger poke and a blood spot is tested for lead. But if the value is more than 3.5 or higher, then we always want to confirm with a venous sample or a true blood draw. It's more accurate.
So for levels between 3.5 and 14, it's recommended to retest every 3 months to ensure that the value is decreasing and not increasing. And then the children should be screened for sources of lead exposure, iron deficiency, anemia, which we know can exacerbate lead absorption. And then depending on the state they live in, there may be a home inspection to identify possible sources of exposure.
For children with levels between 15 and 44, you want to repeat the level in 1 to 4 weeks to ensure that the level is not increasing rapidly, and then every 3 months until it's less than 3.5. For children who have a tendency to put foreign objects in their mouth,
like every kid,
and the level is increasing after that initial test, a lot of times we'll think, did they swallow a toy that might be contaminated with lead? And so we might get an abdominal x-ray to make sure that there's not a lead-containing foreign body that's stuck in their GI tract. And of course, if one is identified, then we're going to need to remove it.
Only for kids with lead levels greater than or equal to 45, which is pretty rare, would a child be treated with a medication known as an oral chelating agent and then monitored closely. This occurs in the hospital while this is being initiated so that we can really monitor the kids really more closely. And usually it's done under the guidance of a toxicologist, and then levels are monitored at least weekly while this is occurring.
Yeah, lead exposure is still a serious concern, particularly for young kids. But the good news is that, there's so much more awareness, there's prevention strategies and systems in place that most lead exposure can be preventable.
That's right. So if you're living in an older home or concerned about your child's risk of lead exposure, talk to your pediatrician about testing and what steps you can take to ensure a safe environment for your family.
And remember, regular cleaning, proper nutrition, and testing in homes and water sources is the best ways to protect your kids. Lead poisoning might not be as common as it was at one time, but it's definitely still something that every parent should be aware of.
Thanks for tuning in to Kids Considered. Be sure to check our website for more resources on lead exposure and prevention strategies. So we recently just got a letter from our water district. And it said, just to let you know, there must be some mandate on this. They said, just to let you know that we test the water for lead and we tested all of our pipes and we evaluated all our pipes and none of our pipes are lead pipes and the water does not have lead. So that was all reassuring, right?
Yeah.
And then it says, but once it gets to your house, we don't really have any control about that. So you just might want to if your pipes in your house are lead pipes.
Yeah.
And so I thought, oh my God, how do I know? And then I thought, oh yeah, because we redid the house.
Yeah.
We redid the house in 2004 and we've got all copper pipes. I thought we're fine. We're okay.
Yeah. It's like a CYA thing for them, right?
Right.
Oh yeah, we know we're good, but we're not sure about your house. And I have seen it in our community and kids that I see from some of the bathtubs. will over time break down. And, kids spend a lot of time in the bath and the water. I've seen it in soil, from outside. It is definitely still around. Thankfully, I have never seen a level get to the point of needing chelation, which is over 45, and most of the time will come down. But just like we said, even a level over 5 in this early age can cause, potential neurotoxic effects. So, it's one of those things you don't immediately think of as a parent, but especially for those of us who live in these older communities with these old homes, always something to keep in mind.
Yeah, so we're in California, so a lot of the homes are going to be newer and the pipes are going to be newer. When I did my pediatric residency, my training in the 80s, that was in Boston. And, in the Northeast, of course, there's a lot of old houses. I mean, that's what makes it charming, right?
Yeah.
And a lot of lead paint exposure. And bread and butter of my pediatric residency was we saw kids with lead toxicity, unfortunately. Of course, that's one of the issues we talked about during this episode. It's a public health issue, too. And a lot of those public health measures hadn't taken place. They were kind of state by state in terms of screening and mandates and stuff like that. So we would see a lot of kids with lead toxicity, unfortunately, and do the chelation, the inpatient chelation, too. That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter @KidsConsidered.
And Instagram @KidsConsidered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.